The Mayo Clinic's third national health checkup showed some new findings about America's heart health awareness, their opinions and behaviors. Dr. John Wald, the clinic's medical director for public affairs, is here to share some of the findings. Good morning, doctor.
Good morning, Tina. Great to be with you today.
Thank you so much. Well, what were some of the findings that you found particularly interesting?
Well, Tina, I think first we continue to learn that Americans are very savvy health consumers. In our last survey, we learned that overall, Americans were most concerned about cancer in their lives. But in this most recent survey, we found that 2/3 of African Americans felt like heart disease was the leading health concern in their lives. And I think they have reason to have that concern. They have an increased risk of heart disease compared to the overall American population, and we need to address that.
Were there certain maybe triggers that are causing Americans to think about improving their heart health, as you're saying?
Well, first and foremost, we know that a family history of heart disease makes Americans think about their heart health. 25% of Americans have a family history of heart disease under the age of 55. And it's those things, that awareness, that allows individuals to understand what the symptoms of a heart attack are. In fact, 85% of those individuals were more aware of the symptoms of a heart attack just by having a friend or family member with a history of heart disease.
I know we're talking about history. What about just everyday stress? How does that impact our heart health, or what we can do to not so much a factor?
Well, stress is certainly one of the things that contributes to our overall heart health. Along with hypertension, obesity, and levels of cholesterol, stress can impact the disease that attacks our heart. We found that our job and school was the leading stressor in the lives of most Americans. And we have to look to relieve that stress. We have to walk away from that stressor. So if you're not at work, put down that electronic device once in a while. Walk away from those emails and spend time with friends and family, which can lead to an increased resiliency in all of our lives.
Well, that's something we can all definitely take as a suggestion and implement into our daily lives. What about when it comes to generations and millennials? Was there a difference how we view it also in generation-wise?
We didn't see a big difference in the generational gap when it comes to heart health. But what we are seeing is that millennials are tending to exercise more. Millennials are using apps more than older individuals to monitor their overall health, including their heart health. We've seen individuals reach to Dr. Google, the search engine, to get information about their health. 70% of individuals are now going online to find information about their health, and 60% of individuals are managing health concerns by reaching out and finding that information online.
So actually, technology and our phones may be actually helping us along the way. Some of us in those older generations, like myself, should definitely be taking the steps of the millennials. What about when it comes to men and women? Was there any kind of a gap there?
Well, when we look at heart health, men and women look at it a little bit differently. Men are more likely to exercise as the first opportunity to improve their overall heart health, and women oftentimes turn to diet to improve their heart health. We also need to talk about the difference in heart disease when it comes to men and women. Symptoms for heart attack can present very differently in men, and I encourage folks to go to healthcheckup.mayoclinic.org to learn about some of those things. There's a disease called SCAD, spontaneous coronary artery dissection, which can lead to heart attack in younger women. And so we need to think of this not just as an old man's disease, but as a disease for all Americans.
Well, Doctor, what I'm really taking away from talking to you today is whether it's an app to monitor how we're doing or going to that website to educate ourselves. A great way to do this is to be informed.
Absolutely. And survey after survey tells Americans want to be informed. They're knowledge seekers. And our website, mayoclinic.org, is one of the most viewed websites because of that. Patients are looking for information and guidance, and then ultimately, if they need to reach out to care, they can come to an organization like ours, Mayo Clinic in Phoenix, Arizona, to seek care for those complex medical conditions. So a healthier America is a better America, and it also leads to a decrease in the overall cost of health care if we are healthier Americans.
Well, doctor, I want to thank you so much because, as you're saying, we were doing just that today and doing a little bit of education.
Thank you, Tina. Have a terrific day, and thanks for the time this morning.
Absolutely. Don't go anywhere. The Morning Blend. We'll be right back.